Hello and welcome. Today we're diving deep into a rare and complex autoimmune disorder that affects not your sight, but your hearing and balance: autoimmune inner ear disease, or AIED. The exact cause of AIED remains somewhat of a mystery, but the underlying mechanism is clear. The body's immune system mistakenly attacks the delicate structures of the inner ear. In other autoimmune diseases like rheumatoid arthritis, the body attacks the joints. In AIED, the target is the inner ear. This immune response may be triggered by a prior viral infection, another underlying autoimmune condition, or even genetic predisposition. However, pinpointing the specific trigger in each individual case is often challenging. Let's talk about how this attack affects the inner ear. The inner ear is responsible for both hearing and balance. When the immune system attacks, it can damage the cells responsible for transmitting sound signals to the brain, resulting in hearing loss. Similarly, damage to the balance organs in the inner ear disrupts the body's sense of equilibrium, leading to dizziness and imbalance. The damage often involves inflammation and cellular destruction within the cochlear and vestibular system. AIED is considered a rare condition, making it difficult to establish precise epidemiological data. It's estimated to affect a small percentage of individuals with sensorineural hearing loss. It can occur at any age but is most commonly diagnosed in adults between their 20s and 60s. There's no known significant difference in prevalence between men and women. The symptoms of AIED can be quite debilitating and often appear suddenly or progress rapidly. The most common symptom is rapidly progressive hearing loss, often affecting both ears. Patients may describe difficulty understanding speech, especially in noisy environments. Balance problems, such as vertigo, dizziness, and unsteadiness, are also frequent complaints. Tinnitus, or ringing in the ears, is another common symptom. Some individuals may also experience a sensation of fullness or pressure in the ears. Diagnosing AIED is challenging, as there's no single definitive test. The diagnostic process typically involves a combination of audiological tests, such as audiometry to assess hearing loss, and vestibular testing to evaluate balance function. Blood tests may be performed to look for markers of inflammation or other autoimmune diseases that might be associated with AIED. Response to steroid treatment can also be a supportive diagnostic indicator, but it's not conclusive. Ruling out other possible causes of hearing loss and balance problems, such as infections, Meniere's disease, and acoustic neuroma, is crucial. While there isn't a universally accepted classification system for AIED, it's often categorized based on whether it's a primary autoimmune disease, meaning the inner ear is the primary target, or secondary, meaning it's associated with another systemic autoimmune disorder like lupus or rheumatoid arthritis. Identifying the underlying cause is essential for guiding treatment strategies. The primary goal of treatment is to suppress the immune system and reduce inflammation in the inner ear. Corticosteroids, such as prednisone, are often the first-line treatment. These medications can help reduce inflammation and improve hearing and balance function. Immunosuppressant drugs, such as methotrexate or cyclophosphamide, may be used if corticosteroids are ineffective or if long-term treatment is needed. Hearing aids or cochlear implants may be recommended to manage hearing loss. Vestibular rehabilitation therapy can help improve balance function and reduce dizziness. Because the exact triggers for AIED are often unknown, preventing the disease is challenging. Maintaining a healthy lifestyle, managing stress, and promptly treating underlying infections may help reduce the risk. If you have a known autoimmune condition, careful monitoring for hearing and balance changes is recommended. The prognosis for AIED varies depending on the severity of the condition, the promptness of diagnosis, and the effectiveness of treatment. Early diagnosis and treatment can significantly improve the chances of preserving hearing and balance function. However, some individuals may experience progressive hearing loss and persistent balance problems despite treatment. Ongoing research is focused on identifying biomarkers for early diagnosis, developing more targeted therapies, and understanding the underlying mechanisms of the disease. Studies are exploring the potential of biologic therapies and gene therapy to treat AIED in the future.